Good afternoon, everyone, and thank you for joining our webinar, How COVID-19 Has Changed the Way We Clean and Disinfect Elevators. My name is Michael Morin. I'm Vice President of Business Development here at Stanley Innovation, and I will be moderating today's webinar. Now I'd like to introduce our panelists. John LaRochelle is the CEO and founder of Environmental Infection Prevention Company, and John has over 30 years of facilities management, infection protection, and protecting people, products, processes, and buildings. Today's agenda will give a quick overview of Stanley Innovation. We'll give a description of the CASPR 200E. I'd like to introduce John LaRochelle from Environmental Infection Prevention Company, and he'll talk about the unique disinfecting challenges related to COVID-19 in elevators. He'll also discuss how the CASPR 200E disinfecting technology works, including its efficacy and results from scientific studies. He'll also discuss why continuous disinfecting technology is the way of the future. And last, John will talk about how the Resnover Labs independent testing of the CASPR 200E and the results that provided. Before we describe the CASPR 200E, I'd like to introduce Stanley Innovation, as we are an advanced technology company focused on bringing new products to market, and we're specifically bringing the CASPR 200E to the elevator market. Stanley Innovation is a wholly owned subsidiary of Stanley Elevator and the exclusive North American distributor of the CASPR 200E. In the picture, you'll see the CASPR 200E. You'll see the honeycomb matrix on the side, along with the UVC bulb. And that bulb and honeycomb matrix interact to produce the disinfecting modules. In way of size, the unit is 9 inches long, 2.5 inches wide, and 1.25 inches tall. The CASPR 200E is specifically designed for elevators, and it's specifically designed to work in spaces up to 200 square feet. The nice thing about the 200E is that the continuous disinfecting technology works on both the air and the surfaces in the cab. It is a low voltage unit requiring only 110 volt power. It's easy to install and takes 1 to 2 hours to install, depending on the presence of an available outlet on the car top. It operates silently with no moving parts. The maintenance is minimal, where you might have to dust it occasionally and change the bulb annually. You'll note that the bulb does have a 2-year lifespan, but in year 2, it experiences some minimal degradation, and we recommend changing the bulb annually to avoid any of that degradation. You'll also be pleased to know that the CASPR 200E works with natural airflow in the cab, and there's no need to modify the fan like other competing technologies. And the CASPR 200E is small enough to install above the drop ceiling, concealed from the riding public, and it also requires 4 self-tapping screws to fasten to the canopy, and again, making it easy to install. You'll see that the pilot program showed installation locations throughout the elevator, and independent of the location, it had no material impact on the efficacy of the tests. And there is a 1-year warranty on all parts, including the bulb. On the next slide, you'll see some sample installations at the car top above the canopy on the left, and at the upper left-hand corner in the picture on the right. So it doesn't matter where you install it, it can be installed anywhere. And so now I'd like to turn it over to John LaRochelle, CEO and founder of Environmental Infection Prevention Company.
All right, thank you, Mike, for that introduction. And again, welcome everyone to this webinar, and look forward to talking about the CASPR system for elevators. My name is John LaRochelle. I'm the CEO of Environmental Infection Prevention, and I have a career in cleaning and disinfection with over 35 years of environmental infection prevention and facilities management experience. I actually started my career as a housekeeper and worked my way up through Sodexo, a global organization focusing on cleaning, disinfection, and infection prevention. So I do a lot of international speaking related to infection prevention, and created Sodexo's global program for environmental infection prevention. I was the head of innovation for Sodexo for North America. And I'm on a lot of nonprofit groups that focus on cleaning, disinfection, and studying various technologies to help create a cleaner, safer environment. Like any good organization, we have a very powerful advisory board with some of the top infection prevention leaders in the world. Dr. John Boyce, formerly from Yale Medical Center, is one of the key advisors. Dr. Bruce Mitchell, one of the top air specialists out of Dublin, Ireland. Dr. David Bacon, who's a captain in the United States Navy, is an infectious disease specialist in representing the Marines and the Navy. And Dr. Matthew Hardwick, that runs Resinova Laboratory, one of the top microbiological labs in the United States. And you'll see some of the results that we've run through Dr. Hardwick's lab. So the key thing that we should be focusing on right now is what has happened during COVID. And the best analogy that I can give you is the example of 9/11. So with the tragedy that happened at 9/11, it absolutely changed how we went about our lives and how we went about our air travel and the safety around air travel. And that will never be the same again. And I appreciate that because I travel about 100 times a year on a plane. So, but when you relate that to COVID, COVID has absolutely changed the way we're approaching cleaning and disinfection, especially in the non-healthcare environment. In the healthcare environment, we've been focusing on cleaning and disinfection for years, but in many of the non-healthcare environments, we simply haven't been using disinfectants, haven't been looking at air technologies. So we really need to focus our approach and our solutions differently so we can help combat this war on COVID-19. And it's critical to understand is that COVID-19, although it's front and center right now and happening all around us, it's not a one-time event. You know, if you look at some of these other diseases, such as the cold and the flu, you can have 40 million cases a year and over 375,000 deaths. Pneumonia with 150 million cases, norovirus, 685 million cases, and H1N1. So, and we know future risks such as other pandemics, antibiotic resistant bacteria, other things that are facing us are going to create other risks once COVID has subsided. And all the research says that COVID may be with us a long time. The levels may go down a lot, but we're still going to probably get into more of a seasonal COVID, just like the seasonal flu, or it may never go away and just be at a much lower level. So this really is a war on pathogens. And it's real people, it's real lives and real impact. We've never seen anything in our lives like this. And we have to be looking at different innovations and different ways to keep ourselves safe. So one thing, and we're going to kind of look at some of the challenges around cleaning and disinfection, and specifically around elevators. So this is a study that is an amazing research paper that shows the amount of bacteria on an elevator button is 40 times higher than a public toilet seat. This has been demonstrated and replicated in many environments. And when you think of it, the elevator button is one of the first things you push when you enter a building. So that's a critical aspect to understand. And, we've all seen in this pandemic that excessive cleaning is going on. And sometimes that excessive cleaning is counterproductive. Here's a picture of an elevator that, they're obviously applying, multiple products, and you can see the residue all over it. And many times what's happening is the pathogens are still there. They're still living because it's not effectively being cleaned and disinfected. It's just being done multiple times. So really a counterproductive environment. So this is a study of 50 hospitals done by Dr. Philip Carling out of the Boston region, where they looked at what percentage of surfaces were actually cleaned on a daily basis. And amazingly, only 49% of the surfaces are actually wiped by a cleaner on a daily basis. And the reason being is the cleaner is visually cleaning. If it looks clean, they're going to skip over it. They're going to, whether it be the buttons or the rail in the cab or maybe the floor, if it looks okay, they might just skip it. And that's half of the time. And we really need to understand that every spot, every surface is a critical pathway that can transmit this harmful pathogen of COVID. We also know that bacteria can reappear extremely quickly. The best analogy that I can tell you is that, it's kind of the tide on the ocean. When you clean, the tide goes out, but the bacteria and the organisms can regrow extremely rapidly. And you can see, even within 30 minutes of cleaning, the bacteria are quickly starting to rebuild themselves. And even up to 6 hours after cleaning, it may be right back to where you started, if not beyond. So we certainly have to look at how we're cleaning to make sure we're getting enough, and look at various technologies that can support the cleaning effort and keep that bacteria level at a safe environmental level. So another aspect to understand is how long do pathogens live on the surfaces? We know that, various pathogens such as a staph infection, MRSA, can live on a surface for 9 months. Even norovirus and the cold and flu can be days and weeks. We've seen COVID discovered on surfaces that hadn't been touched or occupied in about 20 days. Now, it does die off fairly quickly, in most cases within days, but a lot of times it can survive for a long time. So we need to be mindful of this as we're looking at mitigating the challenges that we face. This is two powerful studies. This is one done by MIT. If you see the graphic, you see the yellow outline of someone's face as they're sneezing. And you see this high-speed camera that's caught the particulate coming from that person's nose and mouth. And the MIT study showed that these organisms can be suspended in the air for minutes and can travel up to 27 feet. In a separate Harvard study, they showed that COVID can stay active in the air for several hours. So whether you're in an elevator, whether you're in a room, someone may sneeze or cough, and this could stay there for hours. So obviously understanding what you have for mitigating technologies is critical. So let's talk about CASPR and the technology it's based on. So CASPR and the technology was really created by NASA originally. The innovation was used in the International Space Station and created to help mitigate odors in organisms. And then this technology has been adopted and refined by CASPR to be used in all types of environment. So this technology has been around for over 15 years and is used in hospitals, schools, colleges, and all over the world in a lot of different environments. The CASPR technology, the way it works is it kind of replicates what's going on outside on a natural sunny day. When you look at the CDC guidance, they always say outdoor dining, outdoor seating is the safest environment. And that's simply because naturally the sunlight collides with oxygen and water molecules, humidity, and creates highly effective oxidizing molecules, H2O2, that is unfriendly to pathogens and can actually eliminate pathogens. So that's one of the reasons why outside on a sunny day is much safer. And so this is exactly how the CASPR technology is actually working. So specifically, the CASPR 200E that's installed in an elevator, you'll see on the upper part of the circle there, you'll see O2 and H2O, which is water molecules and oxygen, passes through the CASPR 200E unit. It is, there's a little UV light inside there in a honeycomb coating of titanium dioxide. And as the air naturally passes through the CASPR 200E, it's creating H2O2 and other friendly oxidizing molecules that are very harmful to the pathogens and reduce them on both the surfaces and in the air. So the next piece to look at is the safety level. Now, one of the first things that my organization and many that have done, because we've done testing in hospitals, schools, colleges, professional sporting teams, was to look at the health and safety. Because anytime you're introducing anything on the surfaces in the air, we want to know that it's safe for our occupants, for our children and the elderly and anyone occupying it. And this is showing that the independent test done on the CASPR system showed that it was 33 times lower than the OSHA guidelines. So far lower than the guidelines, very safe, and is based on an 8-hour occupancy. And obviously elevators, you're in and out very quickly, but this shows the absolute safety profile of the product. Now, elevator air safety is key to understand. There are studies that are showing changing the air circulation in an elevator can negatively affect the airflow and can increase the risk of COVID exposure. So, using any technology that's making you alter that fan or the direction of it is really, counterproductive. And some of the competitive air purifiers that we've studied rely on reversing the fan, which alters the natural airflow within the cab, which is really not something you want to do. CASPR 200E just simply uses the natural airflow of the elevator, whether it has the fan system or not, because it's been tested in both types of environments. And so that's kind of critical to understand the elevator air safety and not altering it in any way. So one of the things to look at is the CASPR 200E and what sets it apart from various other technologies that we've tested both in the lab environment and in the real life environment. So focusing on CASPR 200E, it disinfects both the air and the surfaces. This is critical to understand. There's a lot of technologies that do a great job with the air, but simply don't do anything to the surfaces. I can tell you in working in hospitals that the floors, the surfaces, and as the buttons, as we talked about, absolutely those pathogens on those surfaces, especially the floor, can become airborne and start creating problems. So it's critical to look at both the surfaces and air and any technology that you're looking at. The CASPR 200E also has a lower cost, higher impact value. It uses the natural airflow, so it doesn't require that fan or additional ventilation. And it's simply easy to install. It has low maintenance, really only changing the bulb once a year, and doesn't produce harmful ozone either during the process or as a byproduct. Other technologies, as we talked about, they have to alter the airflow, reversing the fan. It does require additional ventilation. And in both those things, as we talked about before, there's different studies that are saying anytime you alter the airflow is not good and can be counterproductive. A lot of the other technologies are only going to focus on air disinfection. So again, it's not going to get the surfaces. And, you're going to have high maintenance, whether it's changing the filters monthly, quarterly, and different things, putting in expensive fans and ventilation. Obviously, those are all high cost installations, and some of the products can produce ozone that is banned in certain states such as California and not allowed to be used. So let's talk about the microbiological testing of the 10 elevators that were done in the Boston market. These were independent tests that were conducted, sent to the labs in Washington, D.C. to evaluate both before and after the impact of the various, of the CASPR 200E. So, when you look at an elevator, this elevator may look safe, but how do you know it's really safe? Is it biologically safe to enter? And I can tell you from doing a lot of biological testing in the industry that this is an actual depiction of an elevator button, which had 41,000 pathogens on it, over 10,000 fungal pathogens. In the air had over 1,000 pathogens on it, and about 950 in the air of fungal count. So, looking at something visually and understanding what's really on those surfaces is critical to understand. So the CASPR system has been tested in hospitals, Major League Baseball teams, health clubs, and elevators. And before it was even done in those environments, it was done in simulation labs to show it worked. But then it was critical to understand that the technology truly worked in the real environment. Because there's a lot of systems, there's a lot of technologies in the world that simply work in a lab, but when you get in the real environment, they're not as successful. And you can see the graph on the right showing various pathogens, whether it be staph or Pseudomonas, various ones that rapidly get knocked down with this technology. So let's talk about the specific testing that was done on the elevators using the CASPR 200E. All the testing results went through Resinova Labs in Washington, D.C., one of the top microbiological labs in the U.S. Now, just to understand what biological testing means is we're looking for the colony forming units. So how many organisms, live organisms, are living on the surface or in the air, the number of bacteria on these surfaces or in the air. This is really the gold standard when measuring any type of biological input. There is a technology called ATP, but it really can't accurately measure the pathogen level on surfaces. It can't measure air levels, and it doesn't specify what types of pathogens. It simply gives you a number, and that number can be very highly variable depending on the surface you're testing. So, for what we did in the elevators, we really looked at how many organisms were on the surfaces, what was in the air, and studied that over time. So here's an example of the 10 elevators that we studied, working with Stanley Innovation and Resinova Labs. The baseline of the total amount of pathogens was over 10 million on these 10 elevators. After running for approximately 1 week, that reduction level of all the organisms on the air and surfaces was reduced by 92%. The total fungal level went from 6.8 million down to 56,000, which was a 99% reduction. These are dramatic reductions that to be seen. And kind of breaking it out from the macro level to the micro, you can see the air samples, how, the total pathogens, which is the aerobic count, was reduced by 95%. The fungal went down in the air by 100. The buttons went from, 65,000 with a 99% reduction. The fungal count went down 99%. The floor samples, which, we didn't talk a lot about this, but floor contamination, absolutely, those pathogens on that floor can go from the floor into the air through dust particles, and you can inhale them. They can land on other surfaces and recontaminate them. So the floors are critical. And this showed a 92% reduction in the pathogens on the floors. with a 99% reduction of fungal. And then the handrails had an equal 99% reduction of both bacteria and fungal levels. These are dramatic levels of reductions, that's you're continuously cleaning the surfaces and sanitizing them 24/7 as the system is running. So the question is, knowing what you know now, which elevator would you choose? The one with the CASPR technology or the one without? So we'll open it up to the audience for any questions that you have now.
Thank you, John, for a great presentation today. And thank you, everyone, for joining us. Now we'll turn it over to our panel of experts to answer commonly asked questions that we get on the CASPR 200E each and every day. And if you weren't able to get your question answered today, or if you've thought of more, please email us at caspr200e@stanleyinnovation.com. Thank you, and we'll proceed with the questions now. So we have a question here. Does the unit have to be turned off in order to replace the bulb? And the answer is yes, but it can be as simple as unplugging the outlet on the car top and taking power away from the unit, taking the unit apart, and then replacing the bulb and putting it back together and plugging it back in again. So it's a relatively easy procedure to replace the bulb. So another question is, does Stanley do the installation of the CASPR 200E? Yes, Stanley does installation of the CASPR 200E for our customers here in New England, but outside of our customer base, your local elevator company would do the installation and have their mechanics install the CASPR 200E for you. So I would call your local elevator company that services and maintains your elevator to do the installation for you. We have another question here. What is the shelf life of the bulbs? The bulb typically lasts 2 years within the unit, and it degrades over time in the second year. So we recommend changing the bulb every year, and it has at least a 2-year shelf life. Another question is, do we ship the CASPR 200E to Canada? Yes, we already have customers in Canada, and we can ship to Canada, not a problem. We have the ability to use UPS and get through customs and ship directly to Canada, so that's not been a problem for us. All right, another question is, does the bulb replacement require IUEC labor, or can the owner do it? Because it's elevator related, we only recommend that the elevator service company change the bulb. So yes, the bulb replacement does require IUEC labor, and we do not recommend that the owner change the bulb whatsoever. Another question is there an indicator light or way to know if the bulb is on and working? The answer is yes. There is a blue light associated with the bulb being on, and that's how you could tell that it's on and working.
What is the time duration from the before and after test results? So the test from the baseline to the second test was 7 to 10 days. How does the H2O2, or hydrogen peroxide, spread evenly throughout the cab or without passengers? So what happens is the natural air movement as the elevator is moving allows the H2O2 to spread naturally throughout the elevator. The best analogy I can use is it's very similar to when you turn on your shower and the steam fills up the entire room. It's the same thing that's happening with the hydrogen peroxide, and it just spreads throughout, touches all the surfaces, and helps to sanitize everything. How long does it take to achieve optimal results? If a viral shedder enters an elevator with other occupants, how long until it inactivates the viral particles? So the way the technology works is because it's continuously in the air and working on the surfaces, the deactivation process can start immediately. And studies have shown that as someone is coughing or sneezing, the technology can immediately start to deactivate the organisms. I understand the natural occurrence of H2O in the environment, However, isn't it concentrated H2O2 inside the elevator? And is it safe for the occupants? So this technology has been studied and is 33 times below the OSHA and NIOSH limits for H2O2 in an 8-hour span. So it has been shown to be safe for people and occupants, especially in elevator environments. Does H2O2 have adverse effects on electronics inside the elevators? The CASPR 200E and other CASPR technologies have been used in hospitals and many other environments with very sensitive electronic equipment, and we've not seen any adverse effects on those electronics to date. Since the unit runs constantly, is there a buildup of byproduct if the elevator does not move for a weekend? We have not seen any evidence or had any adverse reactions to anyone being in an environment where the system has not run for a period of time. So basically, we have not seen any negative buildup, regardless of whether the elevator is moving or not. How does it inactivate the virus specifically? What is the chemical process that destroys the cell wall? So H2O2 or hydrogen peroxide is used in many of our hospitals as a disinfecting agent. And the H2O2 attacks the organisms, the cell walls, and helps to deactivate them and create a safer environment. How many CASPR units are currently used? Currently, there are hundreds of different types of facilities that use this exact technology throughout the world. In the United States, hospitals, nursing homes, schools, colleges, professional sporting teams, retail operations, all utilize this technology. So it's widely adopted, widely used, with no reported negative adverse effects.
Also included in our list of panelists today is Corey Hussey, the COO of Stanley Elevator, and Ken McCarthy, representing the CASPR company.
Hi there, my name is Ken McCarthy and I am representing CASPR. Does the C200E run 24/7? So the great thing about the 200E is as long as there is power to the unit is running, and as long as there's airflow within the cab, the unit is running. Does the active element decay over time or require replacement? No, the active element does not decay over time. The bulb will decay over time, and that's why it is suggested that it gets replaced at a 12-month basis. But the element itself will not decay. When that bulb is replaced, we suggest just a light vacuum or dust, just to remove any dust off of that honeycomb matrix. But as long as there's no major dust buildup on that honeycomb matrix, that unit will be good to go. Is the unit and its components manufactured in the US? The components are manufactured abroad and assembled here in the US. Is there a minimum humidity level that the C200E works? Yeah, the minimum humidity level for the C200E to work effectively is 10% humidity.
Hi, this is Corey from Stanley Elevator, and I'm here to answer elevator installation specific questions regarding the CASPR 200E. How do you power up the unit? The CASPR 200E is a low voltage device that plugs into a standard 110 volt electrical outlet. You can use an outlet if you have an available outlet on the car top, or run code compliant electrical wiring and install a new outlet to plug into. Where were the units mounted for your tests? Our strategy behind the testing was to determine the optimal mounting location for the CASPR 200E within the elevator cab. So we mounted the CASPR 200E in, I think, 5 or 6 different locations, including above the doors, above the car operating panel, above the drop ceiling on the canopy, in the backside of at the top of the wall in the elevator. And the results from each different location showed no material difference. So our preferred mounting location is above the drop ceiling, close to the escape hatch, if there's a drop ceiling available. This allows for the unit to remain concealed and eliminate the possibility of a rider tampering with it. During your test, were the elevators fully operational and were riders traveling in the test units? Yes. We performed the testing on live elevators. The time frame was in May in Massachusetts, kind of in suburban Boston areas. We tested in a variety of different building types, including a medical center, office building, apartment complexes. And during a time when COVID was a pretty major issue in that area and cleaning protocol was high, and the results showed a substantial decrease in pathogen levels after installing the CASPR 200E. If you increase airflow, meaning better ventilation at the base of the cab and a stronger fan, will that improve effectiveness of the unit? So we tested the units, like I said, in 10 or 12 different elevators with all different fan styles, including 2 elevator units with no fan at all. And the results were consistent across all those applications. Are full test results available to share with customers? Yes, we have test results and the methodology behind the testing that's available for other elevator contractors to use in their sales process with their customers. Do you have to apply for a variance to install one of these units? I'm not aware of any of our current customers having to apply for a variance, but each elevator contractor will have to determine what their local AHJ is requiring as far as code compliance. Does the device have A17.5 approval? Has any AHJ required labeling? No, the device does not have A17.5 approval, and I'm not aware of any AHJ requiring any labeling. How many units are already out, installed, and being used? We have 500 to 600 CASPR 200E devices installed in elevators all around the country. How does this product agree or conflict with the latest Otis study? One of the reasons why we were attracted to the CASPR 200E technology is the fact that it has no moving parts, doesn't require reversing the existing exhaust fan in the elevator, and doesn't change the natural airflow in the elevator in any way. So I would say that the CASPR 200E agrees with the latest Otis study that showed that the most effective means for cutting down on transmission of COVID-19 in elevators is to maintain the existing airflow. The CASPR 200E works with the natural airflow and enhances transmission mitigation that already exists in the elevator.
Thank you, John, for a great presentation. And thank you, everyone, for joining us today. If you weren't able to get to your questions today, or you thought of more, please email us at caspr200e@stanleyinnovation.com or visit our Contact Us page on our website, and someone will get back to you shortly. We hope that you have the great rest of your day and stay safe and stay healthy. Thank you.